Okay, looks like we are live on Zoom and live on YouTube, so I'll go ahead and get started. My name is Carrie Kennengeiser, and I am the Program Coordinator for South Carolina Partnerships for Inclusion, also known as SCPI, SCPI, and I am your host for today. This morning's session is COVID-19 Guidance and Recommendations for Early Childhood. I'm so glad that you joined in, and I know our panelists will have a lot of information to share with you. So your presenters today are Becky Davis, who is the Director of the Office of Special Education Services at the South Carolina Department of Education, Martha Strickland, who is the State Director of First Steps 4K, Kathy Kovacs, who is a Program Manager for ABC Quality at the Division of Early Care and Education at the South Carolina Department of Social Services, Andrea Curitin, who is the ICF Region 4 Head Start Training and Technical Assistance Network Provider, and Mary Lynn Diggs, the Director for the South Carolina Head Start State Collaboration Office. Now, before we get started, I'm just going to do a few housekeeping items to make sure that everyone has the best virtual learning experience. So this session is being recorded and will be hosted on our YouTube channel, and you'll find a link on our website right now for anyone who is interested. So we are live on YouTube, so hello to all of our YouTube friends. And again, this session will be housed there afterward. All attendee video and microphones have been muted. And if you have a question today, and I feel like we're probably gonna get a lot of questions, you'll see on your screen, there's a chat box and a Q&A box. Please use the Q&A box for any questions. We will definitely work to answer your questions today, but I just wanna let everyone know, since we have a lot of content and not a lot of time, we're gonna hold on responding to all of the questions until the very end to make sure all of our panelists have time to share the information. And if for some reason we can't answer a question, we will absolutely get back to you with more information soon. If you do have any other comments or any resources that you found related to this, you can use that chat box for that. Which Sarah, who is our co-host today, she's already put a link to find the resources for today's session, which includes the PDF of this PowerPoint presentation. And as a reminder, if you are interested in receiving child care training credit or CEUs, you must view this live session in its entirety on the Zoom webinar platform and complete the evaluation at the end of the session. If you have any questions at all, you can email us at SCPI, which is SCPI, at mailbox.sc.edu. I will go ahead and turn it over to Becky.
Thanks, Carrie. I really appreciate the opportunity to talk with folks this morning. I'm going to talk about what we're calling the new now. It's not the new normal. There's nothing normal about what we're going through with this pandemic, but it is where we are right now and does offer a good many opportunities for us. Next slide. So again, what we're going through is not normal by any stretch of the imagination. And one of the things that we're really struggling with in all of this is, when do we start? When do we start school? When do we start providing services again? What is it that it looks like? How will we know when we're kind of back open for business? Next slide. One of the things that the State Department of Education has been doing is convening a task force that is called Accelerate Ed. And that task force is made up of stakeholders from a wide variety of venues, agencies, service providers. And what they've done is to look at ensuring that the first thing that we do in our educational system is protecting the health, safety, and wellness of students and staff. And when we talk about the health, safety, and wellness, we're not just talking about physical health, we're also talking about social, emotional health and mental health. Another goal with this group is to give students the best possible learning experience. Regardless of the method of service delivery, the goal is to provide the best possible learning experience for students. And then in order to do this, it requires a collective commitment for everyone involved. This is not just an educational issue. This is a family, student, community issue. And so the report that the task force came up with includes 4 phases: what to do immediately, and this was a little further back in the summer, and then how to plan for what's going to happen in the summer, how to plan for pre-opening of schools, and then reopening, the actual opening. And there is a link that you'll be able to access that has this complete report, and I would encourage you to look at it, because this is what is guiding our districts in the reopening of schools. Next slide. So what this means for special education is that we are committed to the premise that special education students are gen ed students first and foremost. And that's where all of our students age 3 through 21 start, is that general education. The whole purpose of special education is to provide access to the gen ed environment. And so we have to look to see what's going on in gen ed. We definitely know that we are going to need more information and data to inform our special ed decisions as we move forward in this. We also know that this is not a temporary situation. This is not something that is going to go away by Labor Day. These are situations and consequences and repercussions that we are going to be dealing with long term. And unfortunately, we have a whole lot of unknowns during this time, and that makes planning difficult, but it also makes planning critical. We have to have plans, we have to organize, we have to have protocols in place. And there are times when we typically would have plan A and plan B. At this point, we may have to extend that to plan C, D, E, F, and on through Z. But planning is critical. Next slide. When we talk about service types during this time, even for our preschool kids, we're talking about extended school year services. And those are the services that a student would need to continue with if he's likely to regress and not be able to recoup what he loses during extended breaks in the school year. These are decisions that are typically made toward the end of the year, and the services are provided for students who, if we stop services during the break, would lose significantly and would not continue to make progress on their IEP goals. Then we talk about recovery services. When we close schools in mid-March, we know that that has impacted all students, again, regardless of age. So we're going to, as an educational community, have to assess what that school closure meant for students with disabilities. And we're going to have to look, and for all students, we're going to have to look at what is it going to take to help students recover from that break, and then provide the services that we provided through that time. We are calling contingency learning services. The services that were provided from March until the end of school are emergency deployment of continued learning opportunities. They were in no shape or form true virtual instruction or true instruction really of any form. So it was an emergency deployment as a result of this emergency situation. So we'll be talking about supplemental school closure services that a student with a disability may need in order to pick up and move forward with his or her goals. And then for some students, we may be talking about compensatory services. For those students for whom the district was not able, despite good faith efforts, to provide reasonable and practical access and services during this time, it just wasn't possible to provide those services. We may be talking about compensatory services. Next slide. And so the next couple of slides really are related to those services that I just went through. So extended school year decisions were typically made toward the end of the school year, and the students had to meet our extended school year criteria. The reason that services would have been provided would be the need to provide FAPE, and they could be provided as soon as the district and family agreed it was safe to do so. Now, for some of our students, that has been delayed. So their extended school year services have not been able to be provided at this point because of safety issues. Next slide. Recovery services, again, are intended to counteract the effect of the school closures on our at-risk students. Many districts were offering a 4-week academic recovery camp for kindergarten through 3rd graders. This was a determination made by each district. There were funds available to the district for face-to-face services. And these recovery services had to include students with disabilities. This is for the general education program. This was not a special ed service. And changes to the IEP would only be necessary if there were specific services needed in order for the student to access academic recovery. So if the student only needed accommodations, then no changes were necessary. Next slide. We've talked a little bit about the supplemental school closure services, and next slide, and compensatory services. So next slide, please. We talk about what this might look like for preschool children. It's complicated because we don't have a mandatory 3 or 4-year-old services or universal services. And so we're talking about services in a variety of environments: home, daycare, private preschool, Head Start, and public school. Next slide. The next couple of slides that I'm not going to take time to go through, but that you'll have, talk about the critical nature of social emotional learning, SEL. So it's critical that we're taking time to build partnerships, and that's with families, with students, with staff, to determine what we need as a community of service providers and service recipients to cultivate our own capacity to move forward with this. So social emotional learning and that whole community is going to be critical for moving forward. Next slide. And the next couple of slides just talk about some of the critical aspects of social emotional learning. Next slide. When we're talking to teachers, we're talking about the fact that we have to take care of our own needs first. And the example or the analogy that's always used is when you're on an airplane, the flight attendant tells you if there's an emergency and oxygen masks are deployed, please put your own mask on first before you try to help someone else. So what we're saying with this is please take care of your own social emotional needs before you try to help someone else with theirs. Next slide. And so we're talking about teaching and practicing reopening. And I think these pictographs are perfect for helping our preschool population. We're going to need to teach new routines, which means we're going to need to practice those new routines with students. And so on this next slide, you'll see 2 of the best resources that we have out there: the Early Childhood Technical Assistance Center and the National Center for Systemic Improvement. And then our last slide is just contact folks within our agency that you can reach out to. Jenny May is our 619 preschool coordinator, and many of you probably already know Jenny May. And then Angie Neal is our new education associate for speech language and early learning and literacy. I appreciate your time this morning. Please don't hesitate to reach out if there's anything we can do from the Office of Special Education Services.
Good morning. I'm Martha Strickland. I'm the State Director of 4-year-old kindergarten with South Carolina First Steps. For those of you that are aware, and those of you that might not be aware, we provide publicly funded 4-year-old kindergarten in licensed settings. The majority of them are in licensed childcare throughout South Carolina. Next slide, please. So I want to talk with you a little bit about our plan going into the fall and how we're going to support children and families. We will be opening our classrooms on August 17th for face-to-face, in-person learning. Our classrooms will be open. We are definitely, as we've been saying, that our hearts and doors will be open on August 17th. We wish it could be our arms as well, but virtually, you know, at a safe social distance, we'll be doing those things as well to make certain that our children know that we're so happy to welcome them back into our classrooms. We currently have 234 centers participating, and some of those are schools, with 263 4-year-old classrooms across South Carolina. Our big news this summer is that we have developed a complete, fully online student application. It's live and easy to access. Parents can get to this on their phones, on any kind of smart device or computer, and they can upload, even from a phone, they can upload the birth certificate, the Medicaid card, any information that we're required, any separate document that they need to upload. So the entire document is fully accessible online, which is a game changer for us. There's no paper at all. We do ask parents, though, of course, to go visit centers, call centers before they select and choose. We always want to make certain that the center is the right fit for their child and that they're thrilled and excited, and also that there's a slot available at that center. We're preparing to mail out postcards. They'll be rolling out actually the end of this week and the beginning of next week to all Medicaid eligible SNAP and TANF homes of 4-year-olds in South Carolina who would be 4 on or before September 1 of this coming school year. We appreciate the partnership from DHHS and DSS in helping us with that independent mailer that sends out those postcards for us. It's a great way to access parents and actually let them know and understand where we're located. Our website is free4ksc.org. So this is a picture of some of our children, some of our students that were in summer school. We did have face-to-face summer school with some programs. Even though we had over almost about 75% of our programs elect to do a 220 school year instead of the 180-day school year. Not all of them, we left that totally up to parents and to centers if they were ready to come back in the classroom in June. We had about 125 classrooms that participated this summer. We found 3 cottage industries in South Carolina to make handmade masks for our children. So as you can see, they're proudly wearing them. Now, I will say that little group on the right is not socially distancing, but I'm sure that they have been in their family cohort for a while. So I hope this was just for the shot, the picture. But I thought the little girl on the left was quite appropriate because as you see her shirt also has the Nike slogan, "Just do it." So, you know, we've heard that again and again about masks, just do it. So they are proud to display them. And our slogan is that superheroes wear masks. So we're supporting that in our classrooms this year, not making it, of course, mandatory, but we are offering these handmade masks for all students. And we're also going to be getting out masks with our 4K logo on it for all of our staff members. So we're trying to help as much as we can with any PPE that's needed in classrooms, thermal, digital thermometers, hand sanitizer, whatever a classroom might need. We want to certainly make sure that we help them with that. We are really promoting the use of cohorts in our classrooms. to make certain that they stay in that family unit, that all meals are eaten in the classroom with their family unit, that cohort, that of course when they go outside that they stay with their cohort, with their family unit, that they don't mix up with other classes even when they go outside. And we're working on contingency plans to make certain, but as all of you know, in this day and age, it is certainly hard to plan for every single thing that crops up, because if we plan for something, something else certainly does seem to pop up. Next slide, please. So we are all in this together. I just pulled some resources, and there's so many things out on the web that you can find to help children understand. And so that children, just like every other skill, like Becky said a minute ago, we have to teach children these skills. Wearing a mask is not a commonplace thing for any of us. But if we model that as adults and they see adults wearing it, and that it's appropriate, it's expected, and it's how we're going to stay safe and healthy. So there are many resources out there. I've just referenced one, and maybe a couple more might be popping up later. So look for things out on the web to help your children understand how important it is to be able to offer these masks. Next slide, please. This is from Conscious Discipline. We use the social emotional curriculum in our classroom, and this is available on the Conscious Discipline website. A story hand is how to soothe the child. And so as you tell the story and talk about it and fold the fingers into one another, and then use your hand to calmly and gently, make a nice fist and rub it and make that wonderful warm feeling, those connections and those feelings, so that heart and soul and body are connected. And of course, we're going to promote that hand washing and that hand sanitizer after doing something like the story hand. So I'd love you to look up on Conscious Discipline on their website. They have lots of other materials that are free also to help our children settle back into classrooms and to understand. It is difficult for adults even to understand these feelings. So as we know that if what we don't possess in ourselves, we can't teach others. So there are lots of free available information about helping children and adults with that social emotional realm during this really terrific time. And I don't mean terrific in a good way, that we're all experiencing now. Next slide. So I wanted to talk a little bit about our virtual support this year. We will be coaching in our classrooms virtually, at least for the beginning of the year, until we see how things go. And hopefully all this will cool down and just blow away. But our plan at the moment is to support all of our teachers in their classrooms through the use of a tool called Learn ERS, or Learners. Our 4K coaches will be using this in their rooms to help support our teachers and our students. We also use Gold as a performance-based progress assessment for our children. So we'll be looking forward to using those in our classrooms to make certain that we stay engaged with our teachers and our children. Our 4K academies that we normally have at the beginning of August, we're also shifting those to virtual openings and happenings this year. So we're looking forward to that. It should be a fun time. Next slide. So that was the end of my presentation. So these are actual children in 4-year-old classrooms in South Carolina last year. And we certainly look forward to serving many, many more children throughout this coming year.
We're going to pause for a moment for an interpreter switch.
Okay, I think we're good. I think, Kathy, you can yours.
Okay, thank you. Hi, I'm Kathy Kovacs with ABC Quality. And for those of you who are not familiar, we're the quality rating improvement system for the state. And we provide child care programs, the quality levels. And programs that are participants in ABC Quality, this affords them the ability to serve children whose families receive child care assistance. Next slide. So what I wanted to start to do with my part of the presentation is kind of give you an idea of what our agency is doing in response to COVID-19. And as you heard earlier, I am housed in the Department of Social Services. So currently, we know that 61% of our child care programs in the state are open. We suspect that these numbers will increase as school districts decide when they're going to open. The Midlands and the Low Country area have the most child care providers open, with the upstate and PD area following. I know you heard that we offered essential worker vouchers, and these vouchers were provided to people that were working on the front line and were considered essential workers. Those were folks like nurses, doctors, EMT people, people that worked in grocery stores, those kinds of roles that were essential. They were allowed to apply for a voucher to have child care assistance, and it was not based on income. So we provided 8,030 essential worker vouchers, and those vouchers are supposed to end at the end of August. There's a possibility that we might extend that deadline, but I believe that if we do extend the deadline, there will be some income eligibility requirements around the extension. We had our state moved programs that were serving children half-time. We moved those vouchers, all those vouchers, to full-time vouchers, and those were primarily programs that were, served on off times when school didn't serve, and then they had to meet the call of providing services to children when schools had to close. We also provided PPE materials to child care programs in the state. We sent out a survey, and people responded to the survey what their needs were. And those people that responded to the survey were provided PPE materials. There were 730 child care programs in our state that received these materials. Next, we are finishing up our, we offered emergency operation grants, and these grants were provided to support child care providers for the loss of income because of closing, to help them with business expenditures, and also they could use the money to, if they had to close, to reopen. These grants were in the amounts of $10,000 for a program that had a small capacity, $13,000 for medium, and $15,000 for large. And then our family child care providers got $5,000. And we did not, our license exempt programs that were in quality were not eligible, nor was Head Start eligible for these grants. Right now, approximately 1,600 people or programs have received these grants, and we're getting a little bit still trickling in. And then also we provided sanitation grants, and the purpose of these grants were to help providers do deep cleaning, buy PPE materials, supplies that they would need to keep their facilities clean as a result of COVID. And we provided centers and license exempt providers $600, and we provided family home providers $300. And we gave about 750 of these grants. Next slide. Okay, so I wanted to kind of tell you what the agency's recommendations are for if there is a case of COVID in a child care center, whether it's exposure to somebody, a client that has it, a staff member, or a child. So the state is recommending that the program contacts DHEC. DHEC has a care line, which I'm going to provide you that line in the chat box, the number for that line, when I'm done with my presentation. And they will give the child care program guidance based on their program. And the guidance is based on the size of the program, the size of the classroom, the number of children exposed, and they'll set a plan with the provider, and they'll let them know whether they need to close the whole center or just the classroom, and how long the closure needs to occur, and who needs to get tested. So DHEC is really who we're recommending, a resource for providers to contact if they have any questions. Like I said, they have a care line, and they also have a line that's called South Carolina Hopes. And this line will provide providers or families or whoever support pertaining to mental health issues or substance abuse issues through this time as well. Next slide. So I'm going to briefly go over the best practices for child care programs that we are recommending in our state, and our recommendations are based on information that we have gotten from CDC, the Center for Disease Control, the AAP, American Academy for Pediatrics, and DHEC. And we also have some great videos on our website, so I will provide a link to that so you can look up those. You can watch more extensive videos on recommendations for childcare. There's 2 of them, they're really long, so you might want to get more information for those. Next slide. So the recommendation is that drop off and pick up at child care programs be done differently. Traditionally, we encourage parents to go in facilities, to go into the classroom. So that is no longer the recommendation. The recommendation is to do drop off and pick up outside, and if possible, to stagger the times and set up sign-in areas that provide ways for families to wash hands or sanitize their hands during this drop off and pick up process. Okay, next slide. So we're also recommending a daily health check, and that includes using touchless thermometers to check temperatures and to follow the DHEC recommendations for a temperature, and not allowing anyone that has the temperature to attend or go into the facility. And also having really good communications with families and staff, and letting them know that it's really important if they feel any kind of sickness or coughing, sneezing, if they have shortness of breath or any kind of aches and pains, that they should not come to the center. And that should kind of be a set policy for everyone that has exposure to the program. Next slide. So the next recommendation has to do with group size and ratios. So group size is really something that's really important, and it's keeping group size to as small as possible. The recommendation is not to exceed group sizes of 10. And then, like Martha talked about, having those cohort models where groups remain with their groups, they don't go have exposure to other groups. They're limiting the amount of people that are exposed to that group. And this is real beneficial for child care centers, because if there's a case that comes up, if you follow this model and you're limiting the exposure of to other people in the program, the likelihood of you having to close the whole center down because there's a COVID case is greatly diminished by using that. And then ratios, the recommendation is, as always, to follow licensing regulations and their ratios, but also ABC Quality has ratios that are smaller than the recommendation for licensing. And if you need information about those smaller ratio sizes, feel free to contact me and I can give you more information about that. Okay, next slide. So again, having set policies about when to stay home, making sure that everybody knows what those policies are, and to make sure everybody follows them. Next slide. So hand washing is critical. I wanted to mention that licensing does not recommend the use of hand sanitizer for children. So hand washing is the choice to prevent germs. And it's real important to continue to wash your hands as much as possible. Next slide. Programs need to have practices in place for cleaning and disinfecting, and just limiting the, kind of downsizing the use of items that you have, not allowing children to bring things from home, and making sure that whatever you do use, that you clean it first and then disinfect it. And especially soiled items need to be cleaned and disinfected. Next slide. So wearing masks are recommended for teachers and children over 2, and cloth masks really work the best. Next slide. So physical distancing is recommended. It's really hard though with children. So how you space your classrooms, giving more space for learning centers, putting cots feet to feet, 6 feet apart from each other is really the preferred way. Another recommendation is spending as much time outside versus inside. Air ventilation is really helpful in this with this virus. Next slide. So another thing is recommended to reduce the amount of materials that you have in the classroom so that you are able to keep things really cleaned and sanitized. The idea of rotating items is preferable. Next slide. And this, so I just wanted to briefly kind of go over what our next steps are. So we are currently evaluating how we're going to be conducting our quality assessments. We're looking at what kind of support we can provide providers during this time. We're also looking at how, if we can't do assessments, can we extend quality levels that providers already have? So we've got a lot of questions going on, and we're currently exploring what would be the best for our providers in the state. And then I wanted to mention we are working on supports with the PDGB grant that we just got to improving quality, providing more access, and getting more programs in our state. And we're working collaboratively with our partners, such as First Steps and Head Start and the Department of It. So we've got a lot of collaboration going on, and we're real excited about it. So thank you. And here's my contact information, and I will put the stuff that I talked about in the chat for you to reference. Thank y'all.
That's not done.
Hi, Mary Lynn. I think we're all set.
Okay, good morning. I'm Mary Lynn Diggs. I'm director of the South Carolina Head Start Collaboration Office. And with me today is Andrea Curitan with the Region 4 Training and Technical Assistance Office for Head Start. And we're going to give some basic information about Head Start. And there's one slide that we do not have because it was like last night announcement. So what is Head Start? Head Start promotes school readiness of children under age 5 from low-income families through education, health, social, and other services. And yes, transportation is a part of Head Start services. Now, when we talk about Head Start, we're talking about Head Start, Early Head Start Child Care Partnerships, American Indian Head Start, and Migrant Head Start. And there's a Head Start presence in 45 of the 46 counties in South Carolina. And you may ask which county is not included. It's Fairfield County, but Fairfield County children are served. They just happen to be served in Richland County because the two counties kind of merged at one point. Next slide. Okay. Head Start's support in South Carolina and in the region. So you heard me say that we have a Region 4 training and technical assistance, and it provides Head Start grantees with high quality, sustained, intensive training and technical assistance. And it says, according to the legislation, the maximum extent possible, and it improves the capacity of local programs to deliver services. So Andrea Curitin will be helping us. And then, of course, you're asking, well, what does Mary Lynn do? Who's the Head Start Collaboration Office, or what are they? But the Head Start Collaboration Office is the portal of entry in state government for and on behalf of Head Start programs. In South Carolina, we are at the Department of Social Services. So we want to make it clear. So you say, well, why aren't you at the Department of Education? According to the Head Start Act, remember, Head Start is federal to local. There are not state dollars in Head Start programs unless it is through a partnership facilitated through the Head Start Collaboration Office. But a Head Start Collaboration Office must be in an office where or an agency where the governor has responsibility. So in South Carolina, it's the Department of Social Services. If we were in Tennessee, it would be in the Department of Education, because the superintendent of education in Tennessee is not an elected official. So the Head Start Collaboration Office is the portal of entry in state government for and on behalf of Head Start. And we are employed in state government, but paid by the department, paid by Head Start at the federal level. Next slide. Okay. You see the Head Start performance standards, and I'm going to make an announcement, and Andrea will move to the description of what you see is 1302. We have the Head Start Act, and then we have Head Start performance standards. Head Start is prescriptive. Head Start is a demonstration project. It is designed to do work at the highest level, and it leads the way. And after a certain time, many of our partners will begin to embrace some of the same work that Head Start does. So Head Start's 55 years old. As you know, it is a demonstration project, but it is for all early care and education, and we are to partner with others. But we want to share with you, because there's a press release, and this happened last night, so this wasn't going to be on the slides. But the announcement is the CARES Act gives additional funding to South Carolina Head Start programs. South Carolina Head Start programs receive $10 million through the Head through the Corona Aid and Relief Economic Head Start Services, and for Head Start eligible children under the age of 5 in South Carolina. Nationally, $750 million has been designated to Head Start programs to support preventive, preparedness, and response activities related to what is included in the CARES Act, and to support low-income children who have experienced disruption of services during this time. And the programs will provide some supplemental summer Head Start programs as they're able to, and then funds will release directly to 1,600 local Head Start and early Head Start programs in the country, including tribal programs in every state and territory. And it points out that the president secured more than $6 billion to supplement human services, and Head Start is a part of the U.S. Department of Health and Human Services. And know that in investing in these programs, according to the administration, is to focus on the whole family to approach learning and development that can provide what is known as a pivotal process for the success of children and families. South Carolina Head Start programs are using these funds to provide a full range of comprehensive services to the extent possible, with a focus on preparing children for the coming school year and providing critical support to enroll children and families and safely returning the Head Start services. You may or may not know that the Head Start performance standards require our following the school district schedules. So we are waiting to see what each school district in our state will do. There are 25 South Carolina Head Start grantees. There's a Head Start presence in 45, as we noted, 45 of the 46 counties in South Carolina. And Head Start are presently recruiting children and families for fall enrollment. So you may go to our website or go to the website of the South Carolina Association of Community Action Partnerships, that's SCACAP, or the South Carolina Head Start Association, or contact the South Carolina Head Start Collaboration Office located at the South Carolina Department of Social Services. And thank you, and I defer to Andrea Curitin, who is our T and TA specialist. Thank you, Andrea.
Andrea, can we stop for an interpreter switch?
Yes.
Okay. Okay, I think we're ready.
We're ready. Okay. So thank you, Mary Lynn, for that information. That is such a good news for us. And so I'm so excited and seeing how that was going to be rolling out soon. So thank you. So our biggest thing in Head Start right now, in our perspective, how do we stay healthy and safe during this time? So I'm going to provide you with some resources, some information that will sort of guide you through this process as well. And Kathy did mention some things that we were going to talk about today, so which is really good. So we're all on the same path. Next slide, please. Caring for our children, supporting standards. I don't know if some of you guys are familiar with that. Caring for our children is the National Health and Safety Performance Standard Guidelines for Early Care and Education Programs. This is a very, very good resource. A part of our standards, it does yield to listening to the National Health and Safety Standard around this practice. So one in particular that I'm going to talk about today is around the hygiene practices. We do know that the hygiene practices will change. And so I'm going to give you some guidance on that. And hopefully I will be putting this link to the book because it's actually a free resource online that you can be able to go to. So I'll put that resource for that. I'll provide that, Carrie, so they'll be able to go straight to the resource. Next slide. So the Center for Disease Control, CDC, has given us some guidance for child care programs that actually remain open. Now, this guidance, I will tell you, will be updated often. As you see, things are changing so frequently. So as of now, the last time it was updated was April 21st, but it's more of a preparedness guidance for you. But again, you will have the PDF version of this PowerPoint, so it will be able to take you straight to the link. Next slide. So all EC programs should follow best practice and standards. And for us, it's of course, we have our Head Start performance standards. So to have CCDF and Caring for Our Children, and our state licensing, which is DSS, and our local health department, which is DHEC. And I actually went on DHEC's website yesterday. They are keeping that website very updated on daily. So it gives you guidance on far as your information, some cases in our counties, as well as state and county. Next slide, please. So this resource is actually my favorite. This is from Caring for Our Children. It is designed to provide information to help caregivers, teachers, child care, health care consultant, provide safe and healthy early care and education environments during the pandemic. It basically, how it's set up is with a list of questions and issues, and on the right side, it shows how the Caring for Our Children addresses it in their standard. And I have provided this resource for you, but it's very, very detailed. A lot of the things that Kathy mentioned about the ratios, the cleaning, it'll take you right to that to give you a deeper dive into that. Next slide. So what are best practices? The same thing about the drop off, the communicating with families. I'm going to focus on the cleaning and sanitizing and disinfectant. So when I was thinking about this presentation, the one thing I was thinking about is how accessible are some of our cleaning products. And as you know, a lot of you are in the community, we're in the stores. So how would that look for that in our programs when we're open up, far as Are we able to get those PPE? I was thinking about bleach. I went into the store and bleach is maybe a little bit smaller, or I'm not finding it as often like I did before. So thinking about approved sanitizers. And then the Caring for Our Children resources in the appendix, it takes you to the EPA website where you can sort of put in information to make sure the products that you're actually purchasing is sort of safe for our children. Because sometimes those disinfectants are too harsh. So things that they may use in like hospital settings. Next slide. So communicating with families. Our biggest thing within Head Start is that communicating with families is definitely key. So one thing I want you to think about is updating emergency contact information. Maybe now, well, before all of this happened, you were doing it not as often, but looking at it, doing it monthly, or even if you have to do it even weekly to make sure you have that contact. Informing families about your policy during the COVID pandemic emergency response. How are you going to communicate with parents on how they're changing, on some of the changes? Are you doing a call with them? Are you doing a Zoom with parents? Just to keep them connected. So checking in with families. One of the things our programs are doing is we have family advocates who are actually helping families through this time. So for example, we have provided some diapers, wipes for families. They're doing a drop off on the porch or something, or providing in their offices where parents can be able to come in and get some support. We even had our family advocates help parents with the unemployment. That was something that was really, really big at this time. And we had families that were really unsure on how to do that process. So they provided some guidance with them, with our parents, just being there with them. Okay, next slide. This one is physical, but not social distancing. So let me explain. So you do stay 6 feet apart, but safely physically distanced. Social engagement is important, but let's physically distance and socially engage. So of course, during this time, our families may feel like alone. So we were trying to find ways and innovative ways to stay connected. So I do know some of our programs have, and some of our teachers have done Zooms with parents and the child, and just to read a story with them as well. Of course, they've done drive-bys just to say hello to them, just to keep them connected to us. Okay. Next slide. So our goal, and this is everyone's goal, is to reduce the risk of getting COVID. Reducing the risk is different than 100% of preventing the spread of COVID. We can't stop the spread of COVID at this time, but we can focus on health practices and lifestyle to reduce the risk of getting COVID. Okay, next slide. So what may be different? And Kathy really did a great job talking about some of these things as we're opening up, but looking at some of the things that you may encounter, the physical distancing, the hygiene, the PPE, the exclusion, the daily health checks, space for ill children and staff, serve children individually, and supplies. Remember I said that before, looking at how it was easy to get your gloves and things like that on a normal basis, but how would it look like now? And how financially will that affect your program? Because as you know, prices are different now. If you go and look for, say, something to buy some gloves, it's definitely not the same price. So that's just something to think about for as the money part when you open your center back up. Okay, next slide. Right. So the information provided today was from the National Center on Early Childhood Health and Wellness. So you're going to have the PDF version of this PowerPoint, so you'll be able to email them directly. And of course, the website to our Office of Head Start, the ECLEC website, which is tons of resources there. And of course, when you are able to get the PowerPoint, we actually have a health information slip. So you can just click right on it. It'll take you right to the information. Next slide. And thank you. And if you have any questions for Mary Lynn and myself, here is our contact information and any questions in the Q&A box. Thank you.
We have one question in the Q&A box. If anybody has any questions that they want to ask, you can please type them now. The question we have is, what are the student to staff ratios for 3K and 4K special needs? Um,
Sarah, can you repeat the question one more time, please?
What are the student to staff ratios for 3K and 4K special needs? It's 3K and 4K question mark and the special needs question mark.
Okay, I'm wondering if this is who this question might be particularly for. Maybe the asker can provide a little bit more context so we know which panelist should tackle it. Or if any panelists have any information they want to share.
And Carrie, this is Becky. I did type a response that talked about, it depends on what services the student's receiving and who's providing those services. So it kind of depends on the setting that the student's in and how he or she is receiving services and what kinds of services there are.
Thanks, Becky. Kathy, did you respond? I see you're unmuted.
Yes, and so if you are, typically the ratios for quality, which is less than the ratios for licensing, is 1 to 7. So if you were following the, and that's for 3-year-olds, and if you were, and for 4-year-olds, it's 1 to 11 for quality. But if you're reducing the group size to 10, then if you had 3-year-olds, you probably should have 2 staff. And if you had 4-year-olds, you probably should have 1 staff. So it just depends on, what the makeup of the group is. But remember, those are just recommendations, and we cannot require people to do lower ratios than what are mandated by our licensing childcare laws.
I have a more detail. If a child is in a special needs classroom, 3,4K, a combination of pull-out and push-in services. That's the context that the asker was thinking within.
So again, it's kind of going to depend on what the services are. Typically, a resource teacher can carry, and that's a teacher who would do the pull-out, push-in type situation. If the child's in the gen ed setting, a resource teacher can carry a caseload of 30 up to 33, but can only carry the number of students that she can provide a free appropriate public education for, or a FAPE. A speech language pathologist, on the other hand, can carry a higher caseload. If we're talking about more of a situation where the child is receiving more than 40 or more than 60% of his or her instruction in the special ed setting, then that's going to be typically 12 students.
So that would include the self-contained classrooms?
Yes.
So 12 students? That's the only question we have. I hope we answered it.
I'm gonna pop back on. I know it is already after 10:30 and I really want to be mindful of everyone's time. I imagine we were going to have questions and this was going to go over, so I apologize for that. If you do have any questions, you have all of the panelists' contact information. Definitely make sure to reach out to them if there's something that wasn't fully answered, you're still wondering about, or if you think of anything later. And again, you can always use our contact us button if for some reason you forget or misplace their contact information, and I will forward it to to them, excuse me. I'm gonna pop up the evaluation. We appreciate your feedback. And again, if you are interested in receiving any type of training credits, childcare training credits, CEUs, we need the evaluation in order to provide that to you. If you participated on the phone this morning, but had registered with a different email and are seeking these training credits, please send me an email with your full name, with the name of the session and the number for which you used to call in this morning. And yeah, if you have any questions, use the contact us button, or you can email me at skippy@mailbox.sc.edu. I want to take this time to thank all of our panelists. I know this was a ton of information and you guys did an awesome job really trying to squeeze it all in and be concise, which I know it's hard because this is a hot topic and it is a moving target. So thank you very much to all of you, Becky, Martha, Mary, I just made up a name, Mary Lynn, Andrea, and Kathy. And thank you again to Beth Ann and Brian for providing interpretation services. So we are almost finished with the evaluation. We're about 86% completed. I'm gonna leave this up so that folks can make sure they provide our feedback. And again, thanks to everyone. If you've already provided the feedback, feel free to exit out. I know we have another session coming up at 11. So again, I wanna be mindful of everyone's time. All right, we're at 100%. Thank you so much. It looks like there was one more question in the box. Thanks, Lisa. I appreciate that. And again, if you have questions, just feel free to email the panelists. All right, thanks everyone. Gonna stop the session. See you soon.